we are talking about SMILE, which is already established for so many years. And my worthy opponent, Dr. Shri Ganesh, one of the pioneers in the technologies, doing it for 4 years. Contoura, which has come in comparatively recently, but showing a lot of promise. So the first introductory slide, because this is me versus Shri Ganesh, is that the audience should know.
That I did not get Contoura. No, that I did not get Contoura.
So the audience should know what did Dr. Shri Ganesh get done on his own eyes. Definitely it wasn't SMILE. So it was lasik. What was the purpose of lasik? I think I'll leave it to Dr. Shri Ganesh to talk about it in his time. Okay, so just a brief about what is Contoura. Contoura is aspheric treatment, plus it is correction of corneal higher order abrasions with the help of topography. So it is aspheric plus corneal higher order. So adding that corneal higher order gives it that little edge which you will not have it for other routine procedures, including SMILE, because SMILE is also considered an aspheric treatment. So it is aspheric plus correction of higher order abrasions of the cornea only. So when we talk about laser vision correction, the two important things that we want to talk about is the quality of vision and the recovery. Of course, there are other issues like bladeless, flapless, etc., but those are secondary issues. The first important thing is quality and recovery. So FDA has made my job simpler because Contoura was there for 1 year, FDA approved. SMILE surprisingly was there for 4 years, but got an FDA approval now a few months back. After so many years, and I don't know why it took them so long. Maybe there was something not just right, but whatever. Now since both of them have got FDA approval, it becomes easier for me to compare the FDA data of the two technologies. So this is the FDA approval comparison between Contoura and SMILE. Both were approved for, is there a thing here? Okay. So both were approved for from 0.25 to 8, but look at the cylindrical component. SMILE was just approved for half a diopter of cylinder, whereas Contoura was approved for 3 diopters. So this itself is a very open indication which is indicating that the manufacturers of the equipment weren't very sure of their own equipment, and that is why they preferred to stay on the safe side, that is the spherical part, and totally kept themselves out of the cylindrical part. That's why just half a diopter was what they applied for with the FDA. Okay, now looking at the visual quality with Contoura and SMILE. Now if you look at this, at 12 months, the 2020 was there in 93% of the cases versus 88% of SMILE. And then if you look down, 2015 was again a higher score with Contoura. 12.5 and 2010, you had recordings with Contoura, but with SMILE they could not even record it. SMILE just stopped at 6 or 2020 and 2015. So Contoura gave a better quality of vision compared to SMILE. And then if you look at the range of correction, look at this. Let me see this. Is the next slide? Yeah. Look at this range of correction, accuracy of correction. At 12 months, 95% were within plus minus half diopters with Contoura, less with SMILE, and 100% were within plus minus 1 diopter, not 100% in SMILE were within 1 diopter. That's a big thing. This is FDA talking. Okay, now let's see about visual recovery. We know there is no wow factor in SMILE. That even the SMILE users say. That the vision is not clear for the first 1, 2, 3 days and then it starts clearing up. Whereas LASIK is instant. You do it and within half an hour the patient has a vision of 6, 9. Okay, let's leave the 3 days. Let's go to a week later and let's see what FDA says in a 1 week's visual recovery. So if you look at this 1 week data of 334 patients, this data says at 1 week, at 1 week, 94%, 94 people, 28%, mind you, 28% had a loss of one or more lines of best corrected spectacle visual acuity. That means even with glasses, 28% could not read the last line and the second last line.
Time.
Unbelievable. Give me 2 minutes. 1 minute. Just 1 minute. Yeah. Okay. At 1 month, it improved, but still 41 patients had that loss of one last line. And at 12 months, 8 patients still had loss of one line. That means even at 1 year, there were 8 people there in the study who did not develop 6-6, but they did not even have 6-9. That is SMILE, which has never happened in Contoura. So if you talk at visual recovery and compare Contoura and SMILE, if you look at these scores, Contoura is about 10% better than SMILE in terms of visual recovery. Then, of course, SMILE talks about corneal biomechanics, that our system is made in such a way that we have better corneal biomechanics. Studies show that there is no difference. The flap-based lasik and flap-free relax SMILE result in similar reduction in corneal biomechanics. And there are a number of papers, I'm just quoting one. So there's no difference in corneal biomechanics. The only thing which SMILE feels they score over lasik or Contoura is about dry eyes. And in this also, literature shows that there's a marginal benefit with SMILE. But remember, all these publications are company driven, so you really cannot be sure about it. If SMILE users cannot even show this as an advantage, then what are they going to show in SMILE which is an advantage? So you still have to remember, a patient who's undergone a SMILE still has to use lubricating eye drops for the same period which the LASIK user has to use. So where's the difference? They don't reduce the lubricating drops to 15 days because we don't have dry eyes.
Last line.
And this is the last line. So what is SMILE all about? Is just a simple aspheric lenticule extraction with poor accuracy of correction, no SMILE lenticule enhancements, no hyperopia correction, no pure cylinder correction, no eye tracker, so poor centering, no wow effect, slow visual recovery, incomplete visual recovery, no reduced risk of aptasia, and questionable reduced risk of dry eyes. Thank you.
Cannot do mixed astigmatism also.
Exciting start.
Yeah.
Great discussion.
SMILE का तो video है.
Sanjay,
Yes.
6, 7 questions from